Hello, my name is Ramnik Mathur. I'm a pediatric A&E consultant at West Middlesex Hospital. This advice is about diarrhea and vomiting, which in medical terms we say acute gastroenteritis, which means inflammation of the gut. And usually it is caused by viruses, very common in summer, and it is very contagious. So if one child in the family has it, then it's very likely to infect others as well. So hand washing is very important, and I'm going to tell you about the signs to look for. So it usually starts with vomiting, and then they sometimes progress to diarrhea. Sometimes it stays only to the vomiting stage without any diarrhea, and sometimes there's only diarrhea without any vomiting. So it can present either way. They can also have some degree of fever, and sometimes it's associated with a cough as well, as it's a virus infection. So the things to look for is signs of dehydration. So if a child continues to pass loose stool or vomit and is not drinking, they may get dehydrated. What that means is lack of fluids in the body. So the signs to look for is dry mucosa, no tears in the eyes, pale or blotchy looking skin, reduced skin turgor. So if you pull the skin on the tummy and it doesn't go back, that's actually a late sign, so don't bother with that. Cold hands and feet, drowsiness, so kids are very sleepy. They will be passing less urine, so body is trying to preserve the water, and they will not be passing as much as urine. And also sometimes they may be breathing fast, or their heart rate may be up because the blood is trying to get to the body quickly. So these are the things to look for. If you've got any of these signs, then you should seek medical attention. What you should try and do is, if they have a high fever and are uncomfortable, you should give them some paracetamol. You can give that every 6 hours, and insist on fluids. So fluids is the mainstay of treatment, but that should be given slowly and frequently. So normally when you come to A&E, what we do is we do a fluid challenge. So we give you a beaker of Diarrhoe light, which you can buy over the counter, and give 5 mils every 5 minutes. Any quicker and they usually will throw it up. So to start with, that's how we progress. And if they are keeping fluids down, then it's okay. But if they are throwing it up all the time, they will need medical assistance. So things to look for, I'll say again, sleepiness, no urine in the last 12 hours, if they are not tolerating any fluids, or if they have a very high fever, or sometimes if they have blood in the poo, then you should seek medical attention. And if they are getting sleepy, then again they will not be able to drink, in which case they should be in the hospital. So they will not need any antibiotic because it is a viral infection and it will take time to get better, but they will need supportive management in terms of fluids, antibiotics, and close observation in case they need intravenous fluids. So we might do some tests to look for dehydration when they come to A&E, but otherwise usually they just recover without much help.